Hi, my name's Terry. I'm a nurse for the contact center here at Memorial Health System. We answer phone calls from patients in the community looking for healthcare advice regarding issues that they may be having at home to determine the level of care that they may need. I've been a nurse for a little over 40 years. Most of my time has been in emergency room nursing. However, the last 5 years I've been here at the contact center. The nurse line is staffed with customer service representatives, which are our backbone for the phone calls coming in. They take a lot of calls regarding class registration for some of the classes that Memorial Health offers. They take calls for scheduling patients from the floor that's being discharged. And then they also take some of the triage calls as they come in, and they'll take the patient's first or main complaint, and then they'll take that message and they'll send it to us. And our guidelines are that we will call you back within 1 hour. Our triage is called telephone triage because we're doing it over the phone. It is a system put in place that follows the Schmidt-Thompson guidelines, which is a national guideline that you go through specifics, what your diagnosis or what your symptoms are, and we follow those symptoms out, and it's a pretty clear path is the normals and the abnormals. So if you fall into the abnormal, then you know to go to the next question. And it takes about 10 minutes, and they are all approved by our physicians. They're specific adult and pediatric. Mom called in and she was asking for a Tylenol dose of her 3-year-old son, which many times patients call in or their parents call in asking for dosages just based on their weight, and they're not sure whether they're given the right amount. And this little boy's temperature hadn't come down from his previous dose. She wanted to just verify. So many times we pull that patient's chart up, verify their weight, calculate the dose out, and tell them exactly how much and how often. However, there was something in the background that made me think this is more than just a temperature. And so we proceeded to have a little conversation, and she had talked about how he was outside the day before playing. It was our first warm day of probably in March, I think. And he had been outside playing all day, and when he came in that evening, which was the day before her call, she had commented that he was breathing really fast, but that seemed to be fine. He went to sleep, went to bed, next day got up, and then had a fever throughout the day. So this evening she'd called in, and I said, "Is that him I hear in the background?" or something to that effect. And one thing led to another, and she said, "You know, he is breathing a little fast again." And at that point in time, he was breathing. I had her count it out. I went through her, told her exactly how to do that, and she counted 37 at 30 seconds, which is very high for a 3-year-old little boy. And but she denied him having any other symptoms. He may have had a cough, I don't recall that for sure, but nothing that made her think, I need to go to the hospital with this child. So then we went on with, I said, I'm going to do a telephone triage if that's okay, which we explained to them it's a 10-minute process. We follow physician-guided protocols and the Schmidt-Thompson guidelines for pediatric triages. And she was in agreement with that. We did the triage. Again, I had her count his respiratory rate out because sometimes you're not sure whether they understand exactly how to do it. And I had her take his shirt off, or else she looked under his shirt to see if he was having retractions, which is kind of a sinking in around the ribs or pulling in of the skin. And at that point in time, I believe she mentioned his abdominal breathing was that she noticed his belly going up and down more often than not. So I knew then she recognized that maybe this breathing wasn't his normal breathing. And so she verified it again, and we were right around the same number. I don't recall what it was, but at that point in time, I said, you need to have him at the emergency room, and you don't want to wait for anybody. You need to either call 911 or bring him in. And so she did. And so then the following day, I happened to be on the part of our job that we call those patients back when they go to the emergency room. And so when I called her back, she actually answered the phone, and I asked how he was doing, and she said, "Oh, he seems to be doing better today." And I didn't realize that she had brought him into our hospital. I was following up because that had been the guideline. And she said, "Yeah, we are up here at Akron Children's in ICU." And which was, we do these triages all the time, and many times I think to myself, I'm not sure whether that made a difference, it did anything or not, but that one was huge for me because I'm sure that little boy wouldn't have been alive if she'd have stayed home. Our system made the difference. I mean, our guidelines and our protocols is what truly made the difference. I mean, that's a good feeling to know that it's a child out there that's playing tomorrow because of mom making that phone call in. But I do think it was because we followed the guidelines. With healthcare, you can't ever fall into, it's just another day. It's just another call.